Okay, we are going to talk about clinical documentation. So, kind of how and where you should keep your clinical documentation for. I'll kind of more specifically talk about mental health counselors, but a lot of it can be applicable to other wellness practices. So, of course, you can store it all paper-based files, kind of DIY, non-web based, or you can do electronic health records. And there's lots of different platforms for that. For non-web based, kind of DIY, paper-based stuff, of course, your clients are going to call or email you to schedule. You're going to make sure that you're using secure platforms for that abide by HIPAA compliance. So, whether it's secure email platform or you have a BAA signed with your, person who you're using for phone and texting or whatever it may be. And then you're going to track this on a paper-based calendar, or if you're using, again, Google Calendar or something like that, making sure you're using it through their Google Workspace account, which is a paid for account, and therefore signing a BAA with them. If you are using paper-based things or putting things in your calendar for appointments and you're not using anything that's HIPAA compliant, then just making sure you're only using like first and last initial. You're not putting any identifying information in there. You're not connecting it to any type of Google Docs or anything like that that has any of their information in it. Just because it's not secure. And if anyone finds your paper-based calendar or anything like that, they're not getting your client's name or any information. And then, of course, if you're using paper-based stuff, you're wanting to make sure that that's stored in a HIPAA-compliant way. Usually, most of our boards require for things to be behind 2 locked doors. So that's like a locked file cabinet, and then in the room that they're in, it's locked, or whatever it may be, or just 2 locked doors in order to get to them. I'd say like DIY, non-web based, like HIPAA compliant or, clinical documentation storage is not really recommended for the ease of you and the ease of your clients. If you keep your caseload like very small, usually like 5 clients or less a week, then it definitely can be manageable to keep everything paper-based. But if you move past that and you're seeing more than 5 clients a week, this is more than just like a side hustle type thing, it's going to be a lot easier for you to keep things organized and for your clients to complete intake paperwork and credit card processing and keep everything all in one. So that's kind of the EHR route, the electronic health records route, and that makes sure clients are able to schedule online and complete their paperwork online and so forth. And this is just going to make it a lot easier for you and for your clients to keep everything all in one space, because you also have to remember with paper-based files, literally anything in that file is your client's medical record. So if you keep like 2 sets of notes, one for you and then one for the client file, it's not really a thing, because if you get subpoenaed, then of course everything is going to be subject to being able to be looked at. So an EHR in that fashion too sometimes is more helpful just in keeping things organized. If you want to use an EHR, I personally use Simple Practice. I really like it. If you want to utilize that one, you can message me or anyone else who uses Simple Practice, and they can give you a code where you can get a little bit of a discount before signing up. Therapy Notes is also a really popular one. And then there's lots of other ones too that are helpful in just like streamlining everything, such as Theranest, Therapy Partner, Therabill, My Clients Plus, Empathetic Clinical Software, CarePaths, Console, TheraLink. So there's lots, but definitely do your research before signing up with one to make sure that it's really going to work for you. And like I said before, kind of clinical documentation wise, this is what you're documenting, after they come to session. Of course, clinical documentation includes all the intake paperwork and everything like that you're collecting from your client before you see them. But that's kind of something a little bit separate that, we can talk about later. But like I said before, it's advised to keep one file per client and house all of that documentation in there in one location. So whether it's the physical file for the client or on their EHR platform. So this is kind of the thing where some people have like process notes and psychotherapy notes and keep those separate. So what a process note is like the, medication details or records, tests, results, summary of, care, diagnosis, treatment plan, symptoms, and, it's kind of summary of their progress, where psychotherapy notes would be like observations on my end, hypothesis, questions to maybe ask in supervision, or any thoughts or feelings relating to the overall therapy session. If the process notes are kept in the client file and then the psychotherapy notes are kept in another file for my personal needs, understand again that if you are subpoenaed, you have to disclose everything that you have on client. Therefore, it is advised to only keep one client note, and make sure that you're kind of filtering that through the space that, again, if you get subpoenaed, the courts or whoever could be reading those. And so all those kind of more psychotherapy notes that sometimes we keep on clients for ourselves or to remind us of future things for future sessions, maybe we jot those down in session and then we shred them after. We don't keep them in the client file. But if you are an insurance-based practice versus a private pay practice, this is also going to look different clinical documentation wise as well, because if you're private pay, you don't have to have like a formal treatment plan. Of course, it's good practice to have one, but you don't have to. Where if you are taking insurance, you're going to have to check with that specific insurance provider to get clear on the expectations of what they will need to see in your notes and in your treatment plans and how often they need to be updated and so forth. Most will want to see like a clear client symptom, how that's being addressed in the time frame for that treatment that's going to be provided. Important things, again, like making sure whether you're insurance or private pay, to have an objective for treatment, have action steps, you want to have support, and then you want to have successes throughout your time with them. And in those progress notes, kind of every session, you're taking notes on you and your client's session. There's lots of different like formats you can use for those progress notes, like a DAP, a GURP, a SOAP, or a PAPE note, or you can just kind of create your own format. Some people, if they're using an EHR, like to kind of have check boxes and create a template for each note, or some people like to, again, have a template copy and pasted and then fill in each information from that session. So, your template would be like seen client from, and then you'd fill in the time. Explored in session, fill in what you talked about. Therapist intervention, fill that in. But in every note, you need to make sure that you're describing like your actions, the interventions that were used during that session. You need to describe your client's response clearly, whether that's with observations or quotes or maybe via an assessment. You need to follow up on like things that you identified in your previous note that you were going to follow up on. You probably need to kind of questions that you can ask yourself in regard to every client. Like you need to, for every client, you need to kind of make sure you have a note documenting that you, of course, obtain that informed consent for treatment, which everyone should be doing in their first session anyways, or before that first session. If there's any gaps in treatment, making sure you have a note documented in there for why there were gaps in treatment, and making sure you have a space where you're talking about, like why is the client entering treatment in the first place. And then, of course, depicting a clear story throughout each progress note over time as to why that client is still in treatment. And Melissa Hall has like a really good free paperwork crash course. I'll link it down below, and also like some free sample like intervention scripts that you can use in your notes. Again, most people, it may take some time, but are going to find a bit of a template or a script that they're going to use for their notes, and whether that's meeting their personal needs and or insurance needs. And then you're going to be able to individualize it for each client and for each session to make sure you're, updating it, of course. But in regards to kind of like the different types of notes and the styles you can write them in, all that information for, again, like a DAP note, a SOAP note, or a GURP note, whatever it may be, there's information on there on the OneDrive about those, explaining exactly what each one of those notes are. You can use one of those kind of formal templates and systems for your notes, but also trying to adapt and make sure it's something that works well for you in the style and the way you work with your clients, because notes are something that cause a lot of issues on people's plates, and maybe something that a lot of people put off on doing. And you just want to make sure, again, that it's a style that fits you, so you don't like hate doing them so much, and so you actually do them. And figuring out when doing your notes is going to work best for you. I know some people like to do them right after that session and just take, a handful of minutes or however long it takes you to sit down, do the note right after the client leaves, and just get it off your plate, charge the client, and move on. Some people like to do all their notes for the day at the end of the day, knock out that day's notes, charge the clients, and move on. Some people like to wait until the end of their week to do all their notes, making sure, of course, if you're insurance-based, that you're following their protocols on when clinical notes and things need to be in the system before filing that claim for the client. But in the end, making sure you're figuring out a system that works best for you, so you're not getting a week or 2 weeks out of a session and realizing you haven't documented that session, because that's going to be really tough to recall exactly what you explored in that session. And it's just best practices to kind of make sure we're documenting within 24 to 48 hours after that session, and kind of getting it locked and filed away in the system. But if you're ever having like trouble formulating some of your notes, there are like kind of prompts to assist in writing notes. So all of this again is on like the OneDrive, but some of the kind of steps you can do is kind of like reflect. So like, why did my client enter treatment in the first place? Why do they continue to come to sessions? And what are their priorities for today's session? So of course, having a reflection, having the result. So what was the original goal my client set for coming to sessions? What is my client's current goal? How does that differ from the original goal, if it does? And today's session, like, how did we work towards that goal? And then maybe focusing on some motivation. So how and why is my client motivated to change? What is getting in the way or assisting with their motivation to change? And then in your session today, how did we work together to get to work together towards their motivation? Focusing on strengths is sometimes helpful if you're having trouble formulating your notes, thinking about those strengths. So what are some positive qualities that my client brought into session today? What is getting in their way and not allowing my client to display these qualities on a regular basis and in outside of session? How can my client implement these qualities into their day-to-day life outside of our sessions? Different skills that your client has. So maybe asking yourself these questions to help you formulate some notes. What did my client come in today wanting to focus on? Did my client seem to have a strong sense of focus today? Will my client be able to leave here today and implement some of these skills that we discussed? And then last, like relations. So noticing if there was any therapeutic ruptures and noting on that. If